Now I have two more topics, allergy and asthma, connected, interconnected. However, I'll give the asthma part later on, okay? Maybe on Thursday or maybe before that if you have time. The topic today, which is allergy. Allergy is a component where there is heightened reactivity in our cells. Heightened reactivity means it is attributed. Have you had hypersensitivity from Professor Salahuddin? Huh? Okay, never mind. It's a part of hypersensitivity, and because allergy itself, oh God, what is IgE mediated allergy. I've told you there are 5 types of immunoglobulins. Out of 5 types of immunoglobulin, I said remove one away, which is IgE, which has nothing to do as such with the immune system working. Nothing to do with microorganisms, with problems associated with immune responses. So the question here is, it is very important to understand that IgE component of the immunoglobulin is only attributed to allergy. Now, what does allergy really means to us? What does allergy means to us? We are not talking about microorganisms. We are not talking about infections. We are talking about different other sources that we may encounter. And when we encounter those, they are not immune cells working there. We have only 2 types of cells. These 2 types of cells basically are the mast cells and the basophils. All right? They are containing granules. In fact, they are containing histamine. And when they are released, the reactivity to our body or system could be minor, could be very drastic. Now, the question here is, are we allergic? If we eat certain food, we feel discomfort. If we go out and we have dust storms, smoke, we get uncomfortable. When the grasses are growing, the trees are flowering, including the date trees, tamar trees, pollens, and we breathe in, we start sneezing and other things. There are many of these can be attributed to chemicals, many of these attributed to other outside factors that are responsible. Now, they are allergens. And these allergens play a very important part in our system. Now, the question here is, usually allergy starts at an early age. But not all allergy will be at the early age. Most of it is. Some may be in adult age as well. But let us say that it starts very early in a childhood stage. If we don't take control of allergic conditions or allergic disorders, then it may actually give rise to many other complications, including asthma. So one has to be very, very careful what we are trying to do. Now, I am going to tell you that if you have a child in your home, or you are going to look in your clinical thing, a child who has eczematic patches, eczema, skin, it shows that the child who has developed eczema will eventually turn over to allergy or allergic rhinitis, which means anything coming to the child will develop an allergic conditions. Now, there are many instances when these allergic rhinitis, though it may be self-limiting, will prolong it. So the child becomes allergic to certain nuts, certain food, and so on and so forth. Further than that, they can develop asthma. Now, the question here is, it shows that it is an allergy march. It starts from a childhood, from a normal skin reactions of eczema, goes on to allergic rhinitis, which can be something that we breathe in, pollens, dust, whatever it may be, develops into more of allergic conditions, and finally leading to asthma. So this is something that happens in allergic reactions. I tell you, there was a professor, and it was 1920, very early. How did we find allergy? This professor, Kutzner, he was allergic to fish, which means when he ate fish, he reacted. Now, how he reacted, I'll tell you. He reacted either mildly, moderately, or to a higher degree. But he reacted. And those reactions will be attributed to the allergic conditions when I come to that part of it. But just listen to me. So this guy is allergic to fish. He cannot tolerate fish, and he has allergic reaction. When another doctor, what he did was, he took the serum of this patient or doctor who was allergic to fish, just the serum, and injected under the skin here. So now, what is happening is, the IgE which was created, the IgE which was created, high level of immunoglobulin C, because he was allergic to fish, was injected into this human. And they took an extract of that fish and injected it at that site. What happened? The person got allergic reaction. So you can see how an allergic reaction can actually be transferred this way, and it emphasizes the importance of IgE as an antibody which is solely for allergic purposes. So now what happened is, this was done very early in 1920, and since then the allergic word and the allergic conditions and the allergic disorders have been more clearly defined till today. Now the same person who was injected with IgE and fish extract, all right, was actually, how would you know that it reacted? How would you know if you react to a substance or a pollen, how would you know the person is reactive? How? He was given a skin test. That's what happened with fish extract, correct? Now, let me take you into a condition. You go to your allergist, or you become an allergist yourself, and maybe you open a clinic where all the allergy patients are coming to you, and you will ask, are you allergic to this, 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 this? You narrow down what is the actual cause maybe. He may tell you, look, during the season, when the pollens are high, I get allergic reactions. It is very possible that this man will tell you, when I eat this food, strawberries, or I eat nuts, I feel very bad. I become allergic. So now what you do, you narrow down those allergens. Now if I am allergic to a nut, peanuts, I may be allergic to other nuts. So there is a cross-reactivity between the food. If I am allergic to apple, onions, batatas, I may be allergic to similar vegetables that there are. So now the question is, what would you do? You say, fine, I have got 20 allergens with me. The possible allergens can be aeroallergens, which are floating in the air. It can be food allergens. It can be cats and dogs' fur. It can be cockroaches. It can be dust mites. You don't see the dust mites here. There may be plenty, which you are breathing. So now the question is, I want to actually find which allergen you will have. So what you do, take an arm, do a small prick. It will not hurt. You won't even feel it. It's just a touch with a needle. And you drop an extract, 1 drop of allergen A, 1 drop of allergen B in the second one, third one, fourth one. So you have 20 allergens covered. Wait for 36 hours. When you wait for 36 hours, You will see redness, flares up, okay? And you will see that many of those don't even react. Some may be small, some may be very large, some may be nothing. It's negative. So there's a measuring ruler through which you put it on where the edema is, and you check, is it large enough to be significant? When you measure it and find that it is significant, then you note it down that you are allergic to this fruit, you're allergic to this pollen, you're allergic to cats and dogs, you're allergic to cockroaches, or you may have more than one combination of allergies. Now the question here again is, if a child in a family, in a household, takes certain food and suddenly there's a problem in breathing, there's a problem of allergic reactions being taken into, what would you do? You would prevent the child from being exposed to such allergens. So say for instance, a child says, I'm taking strawberries. When I take strawberries, I react, I feel I'm flushed out, I react very badly. What would you do? Avoid strawberries. Don't give strawberries. Now there are many individuals who are allergic to peanuts. You know peanuts? They are allergic to peanuts. Very potent allergen. If you remember, if you have been flying on the planes, before they used to give you with your drinks peanuts in a packet, right? They used to give one peanut as a refreshment. They completely abolished that. Planes will not carry in peanuts because peanuts can give anaphylaxis. Same thing as the Chinese restaurant syndrome. So what they started doing was they started giving pretzel. Pretzel where people cannot be allergic to. However, there are certain foods which they may serve which may contain nuts if you are allergic to nuts. So a child who is allergic to nuts cannot have nuts. But maybe the ice cream has. Maybe the cakes have. So you have to be very careful what this child is eating, how to avoid this. Now, yes?
Execution is only avoidance?
I'm telling you, usually this is the first step. Wa alaikum salam wa rahmatullah.
Can I go with you, please?
Yeah, sure.
Sorry.
You feel that somebody comes to you and says, look, I run into allergic reactions, right? And I'm talking from your point of view. You're going to ask the patient, do you know that you are allergic to a certain thing? He says, no, I don't know, right? Okay, fine. But why do you usually have these allergic conditions? Are you because you're outside? Is it because you're keeping cats in your family? Are there cockroaches in the family? No, but I think I am eating food which makes me allergic. Okay, what food did you have? Oh, I had this. Okay, fine. Now, whole day you had 5 types of food. So now what you do, and with your clinical judgment, you will say, okay, don't have one food, eliminate it. Next day, have instead of 5, you have 4. Maybe he is still allergic. So you include back the excluded one and say, take out the other food. So by actually eliminating foods, adding it back, you will come to a position where you will see that the person is allergic to this food. So what is the best source for that? Avoid it. And if you are going to avoid it, and especially with the children, we are so happy, they go for ice creams, they go to cake shops and things like this. We never realize that certain food in restaurants, in ice cream parlors, in cake, they contain nuts. So they should not be given strict, because anaphylactic shock can happen to this child. And if you don't give them proper treatment at that time, they may not survive. So what is the best thing for you as clinicians? The first thing which starts, constrictions, contractions, bronchioles, smooth muscles, everything that will happen in a person who is severely allergic. What you would do as a physician or somebody at home, even it happens, nobody knows, it's not a disease, it can happen, is to keep the airways open so the patient is breathing. All right? When the patient is breathing, you take the patient to the hospital rather than having his breathing stopped completely. So keep the airways open, whether you have to cut this and go through that, but you have to keep the breathing airways going. Otherwise, there'll be a big problem. Now, there are conditions attributed to this. We'll come to that later at the moment. The actual allergen that we talk about is called reagent. Reagent is like an antigen. Okay? So if I tell you what is a reagent, it's not an antigen, it's not a mitogen, it's not a tolerogen, but it is attributed to allergy. And they are IgE class of antibodies that are being created. Now when
Can we create an allergy to some kind of food? Create from nothing?
Well, it does not happen that way. All right? It does not happen because every day in our system, we are taking a lot of food. We are breathing so many things. But still we don't feel that allergic conditions. Yet when the pollen season comes, and there's in the air a lot of these pollens, and you feel sick, you feel running nose, sneezing, understand? But you can induce a person with allergy, I'll tell you about that, if you know that the person is allergic to that. Now, I tell you what you should do. In normal circumstances, if you know what the allergy is, you want to do a regular desensitization mechanism. So an allergy can sensitize you, antibodies are produced, attacks the mast cells and the basophils, eosinophil levels will go up. But what is important here is you try to desensitize. I go to my allergist and I tell him, look, every season, every year, I have severe allergy to pollen, grass pollen, tree pollen. He said, okay, fine. We go through a desensitization process. It may take maybe up to 2-3 years. It's the same like creating tolerance in individuals. So what you would do, I know that I'm severely allergic to, say, dates pollen, right? So this reagent will be injected into my skin. When very minute amount, I do react to that, yet what happens is with repeated injections, desensitization will accept it as self. So now what happens is after 2-3 years, you will never be allergic to anything that you have been desensitized with. Now this desensitization process takes time, but you will be free from those allergic conditions. Now you can't desensitize everyone. You can desensitize somebody when it becomes a problem with your jobs, with your studies, that you say, look, every season there's a pollen and I get this, I get this. So please, I don't need this problems happening. In that case, you desensitize a patient. Now, as you can see, allergic disease has the greatest morbidity and mortality. Asthma, chronic lung disease it can develop into. Allergic rhinitis, again, as I say, seasonal hay fever to pollens and other things. Eczema, urticaria, skin disorders, which starts early in life. And also generalized anaphylaxis can happen. I tell you, I was in the military hospital, and one of my students, who was now a lieutenant general, came to the department. And he asked my general, look, my daughter is so severely sick with allergic reactions and anaphylaxis she goes into. So he called me. And when he called me, and he asked me, and he was also in Tabuk Military Hospital. He was the Director General of Military Hospital there, and a good friend of mine. And he asked me, my child is suffering, please help. The first question I asked was, does it happen with food? He says, I don't know, but it happens frequently. So I said, did you actually took food and excluded certain food and gave her? He said, well, that does not help. Okay. Have you got cat in your home? Oh yes, I have a pet cat. I said, I found your allergens. Get rid of the cat and she will not suffer anaphylaxis. He got rid of the cat and the child was perfectly all right. So this is something which came from the blue, and because I knew that a child can be very allergic to cat furs and other things, it became my judgment which proved to be right. I could have been wrong, but that was right at that particular time, because I know they are potent allergic reaction and anaphylaxis can happen. Now there are cockroaches. Here there are a lot of cockroaches. If the cockroaches are running on your clothes and anything, and there's no more, but even if you touch it, you get rashes all over your body. My wife used to get rashes. Then we found it was due to the cockroaches. Why? Because I did a skin test for cockroach extract, and she reacted. So the question here was, then I started spraying everything to get rid of the cockroaches. So now the question here is, it starts with eczema, skin disorders, urticarial rashes, which is called skin disorders, goes into allergic rhinitis, then these same people will become seasonal hay fever sufferers. Then it can go to food, and eventually it will end up with asthma. Now it's non-curable, it's a very dangerous one. So obviously we have got to stop it. What we have got to stop it? If we have child has eczema patches, skin disorders, we try to cut that out. Why is it creating these skin problems? Is it something she's touching? Is it something in there? If you start doing this, and then there are steroid creams which but the question here is, we have got to stop that march. If you don't cut off that march, they will develop into asthma. So this is a very dangerous situation that can happen. Now, as you can see, there are about 15 to 20% in the population who will have allergic reactions. We may have allergic reactions sometimes, but we are so minor we don't even feel it. All right? And you don't have to care about it, because we are always react to many things which is foreign to our body. Dust, smoke, etc., etc. And as I said it, very, very pronounced 15 to 20% of the population you will see these allergic reactions coming. And again, as I said, you can define this in your clinical practice by having a positive skin test for all the allergens I have told you. If you can't do the arms, do it at the back. Okay? 20 allergens, 25, 30, and find out which allergen is actually suited to this individual, to this patient. It can be males and females, it does not matter, the gender does not matter. Okay? It can be minor irritations, as I told you, sneezing or coughing or nasal secretions, but it can also be life-threatening, which is anaphylaxis. If it develops in a chronic lung disease such as asthma, okay, then again there is a problem. There are people who react to drugs, injections, including penicillin, say for instance. So what would you do as clinicians? First of all, if you know that somebody is allergic to penicillin, which there are many people are, then you must take the history of the patient. Have you had this medicine, oral or injection? Have you had any penicillin? Did you have any reactions? Or any reactions to any treatment that you had? The patient will tell you. However, there are certain patients who may not remember. So if you are going to give oral penicillin for sore throat, then obviously they will go into a lot of reactions. These oral reactions, though it's slow, but they will start developing. So you need to have something, and what would you have? Huh? What? What do you have? You have to inject drug. You have to inject adrenaline. Okay? And the question here is that at that particular moment you require a treatment. Not all hospitals, as I've said, will carry these medicines. Here they do. But if you go to remote areas, you may not find it. You don't have antihistamine to give it to the patients. But as I said, these are the treatments which you can instill on the patients who are suffering. Now, many people never realize this. Because of the climatic changes here, there are not very many bees roaming around, okay, or wasps. But in other places where there is a little humidity, food around, you will see these wasps and bees and everything that is taking hold of. They are the potent allergic anaphylaxis can happen with them. One bite and everything blows up. Thickness, edemas everywhere, the same situation as you would see contractions and constrictions that will happen. So what I'm trying to tell you is, I'm not saying that everybody should carry this antihistamine and adrenaline pumps with them to do this, but there is some reactions which may take a little time. As long as you keep the airways open, reach the patient to the nearest hospital so the patient can get proper treatment. Drug reactions are very common in individuals, so again you have to be very exact what is happening with these drugs. Now, when you take a history of a patient, you take the nature of allergens that they are supposed to. In normal individuals, you don't need to go and say, are you allergic to this, are you allergic to this, or because you're not dealing with allergy. What you're dealing with is with drugs. So if I give you this drug, have you had this drug before? Had you had any reactions? Did you suffer anything? Then obviously, if it's the right moment, give the right drugs, whatever it is. If you can't give penicillin, give something alternative of penicillin. All right? So then you will see, again, the timing of the episode. If you are an allergist, you'll take the nature of the allergens which you think, or the history, timing, when does it come? It only comes when there is pollen around, or the fruiting trees. Then you will know, okay, seasonal exposure. Is there a family history? It can be a family history. Or is it exposure to pets? And this is usually a recognized trigger for allergic reactions, which are very dangerous. You do the skin test, you do the total IgE levels. Now, total IgE levels, I have told you, will not give an indicative, it will give you that there's some allergic reactions. But people with parasitic infections with high level of IgE doesn't mean that they are allergic. They may be because they have parasitic infection. I've told you. If the level of IgE, total IgE, I've just given an example, is 20 units, and you get 50 units, then obviously it's an allergic reaction. It's nothing to do with the allergic conditions, right? So you have got to see both of these. Now, the question here is, did I tell you about this man? I told you about that man in the restaurant near Riyadh Palace. I keep on doing this. He told me, doctor, you're eating, when I'm here, while I was eating, he told me, I have a problem. What is the problem? I have frequent loose consciousness. I have sweats coming out of me. I feel sometimes paralyzed. I feel lethargic. I'm taban most of the time. Please tell me, what is it? I said, I can't tell you. He said, no, I'll give you the prescriptions and I'll give you the reports. Give me the reports. He brought the reports, and the report says he's taking antihistamine regularly and he's taking this and he's taking that. I said, when you're taking this, has it improved your condition? He says, no. I said, then go to your doctor and tell him I said it, that he should look for some parasitic infection in you. Okay? I don't know, leishmania, schistosomiasis, whatever it may be. Go to your doctor. Tell him that you're not allergic, but you're reacting to these parasites. And he goes. And they test him. And they test his stool. And they found it was a parasite. They treated the parasite. Today he's so grateful to me for saving his life. So this is a situation that you may, in your clinical practice, may also encounter. So when you do a total IgE levels, it just tells you that you're allergic or you have parasitic infections plus eosinophilia. Okay? So you have a number of eosinophils level. What you should do is look for allergic specific IgE. So when you do a test, a RAS test, and you have these allergen extracts, and you do a laboratory diagnosis on this, and you put all these allergens extracts on it, all right? And you get that these IgE levels, their IgE actually reacts to specific IgE. That's a specific IgE allergen. So you know that it is allergic to a condition which is present somewhere. Now, as I said, okay, we must be responsible to see that this allergic redevelopment does not continue. How it does not continue? When you take history of the patients, you will see that food allergy is very much common in children. All right? You also see that IgE production to inhalant challenges such as pollens, dust, mites, okay, or house dust mites, these are very common. Cats, these are very common in there. And so what you do is, you need to correct these developments. You need to stop it right there. Let it not develop into a chronic stage of asthmatic patients. All right? So that's an important aspect of it. Now if you look at it here, first of all, if you look at the maternal exposure, early exposure in life, may be genetically associated, and the person or the baby who is born is sensitized to those early exposures. It could be basically called as allergic predisposition to leaving into the asthmatic stage. You can have exposure, sensitization, inflammation of the area if it is to do with skins and other things. People will have eczematic patches in the skin. They will also have diarrhea, which involves the GI. And again, exposure, sensitization, inflammation can have it with allergic rhinitis. And again, as you can see throughout, there is exposure, sensitization, inflammation, and the more sensitization happens, the more antibodies are made and more allergic conditions remains. So you have got to stop it somewhere. Otherwise, it will lead to asthma, which is a dangerous chronic condition. There are many different types of tests. I'm not going to tell you this because you can just read it. You know, there are RAS tests. You can look at eosinophil counts. You can look at specific IgE. Again, as I said it, you can have drugs sensitivity. So when you go for desensitization process, and I tell you very much, you are going to desensitize the patient for certain allergen, right? Because it's coming year after year and seasonal after seasonal, and he doesn't want it. He wants, I want desensitization, please. I don't want to suffer this. Now you know that that particular allergen is so potent, it can give anaphylaxis, correct? But even if you take a minute antigen, minute allergen, reagent, and inject it into the skin, you will see the reaction happening, but it's not a systemic reaction. There is a chance that that little minute injection can lead into anaphylaxis. So what will you do? You will be prepared in your clinic with CPR. If this happens, CPR. And you will have the different drugs, antihistamine, adrenaline, steroids, to give to the patient. So desensitization process, you must always be very careful because you're injecting it even in a minute and the person may react. And though it takes 2 or 3 years to completely desensitize a person, he's been exposed to the same antigen that he is very reactive to. So that's a careful message that you can have. If you look at the skin here, skin test, how it looks like. This is almost negative. There are all negatives. This is one which is positive. So you know which allergen it is sensitive to, all right, or allergic to. Most of these are. And if you look at this one also, you have an allergen, you put it, epidermis, you see the inflammatory responses, swelling of the skin, the wheals, and edema, and as you can see here, it raises above your skin level. Here, there are some immediate reactions can happen within 50 to 60 minutes, 4 to 12 hours, 12 to 48 hours. As you can see, nothing has flared here, nothing has flared here, but this is an allergic reaction. Again, intermediate will take a little longer to come down. As you can see here, 4 to 12 hours, 15 to 60 minutes, 1 hour, 4 to 12 hours, you still have that reaction here. Some of these reactions may not be immediate. Some may be delayed. It may take more than 48 hours to develop. And as you can see here again, people with enzymatous patch test again will show the same skin erosions that will happen. Now what is important here? As I told you, IgE is always released. This is an immunoglobulin. But the part which the immune system plays is against the Th1 and Th2. They process these allergens or reagents to produce those antibodies. All right? So there is always this involvement of that. Now, you have to look at the allergy march from the relations to age, severity, what are the organ manifestations or symptoms that can have in an allergic conditions. You can look at exposure, mild or severe it is, and you can look at all these eczema, rhinitis, conjunctivitis, bronchoconstrictions, vomiting, diarrhea, rarely anaphylaxis, and this can happen through food, basically food. All right? You can have it through cats and things like this. But it's rare conditions. Some of these conditions can be attributed to many of these allergens, but they are not as great, as severe as anaphylaxis. It can happen, but everything is responsible. And in your clinical practice, you're going to look at all these before you decide what you have to do. This is what happens. Allergic conditions, eczema, skin patches, okay? Then you have, sorry, this is not a good slide. Then food allergy. The person is drinking milk and then goes out, develops, because already there's an allergic condition here, develops into allergic rhinitis. These are pollens, which are grass pollens, whatever. They develop asthma. Now, asthma can be in the childhood, or it can even be in elderly patients. So once the asthma is developed, there's nothing much you can do. If you look at allergic food allergy, okay, it's food allergy usually people overcome at a later stage. I'm allergic to egg, say, for instance. I cannot eat egg. But you give me little bit to develop that tolerance, then I might be free of egg allergy. All right? So if you eliminate it, then introduce it. Like children. If you have children who are having, lactose reaction, all right, vomiting, gastrointestinal problem, you take away the milk and give lactose-free milk till such time that they develop that system where you can introduce the actual milk. So basically, people who are allergic to food, usually at a later stage, they can take that food because they overcome this, because they have developed this tolerance which is there. If you look at this one, which is called eczema, again, eczema starts and it starts to go down. But as I said it, if you're not allergic to any of these things, you know, these eczema patches will just vanish. Okay, you put some cream, steroid cream, and so on in children to avoid these skin disorders, and then they may vanish. But one thing which is important here is your respiratory allergens. which are always high because they are new pollens, yeah.
Can you build the tolerance against any allergen with small amount?
That's what I said. Desensitize. Desensitization. Yes, you will not get that allergy. If you keep on for 2-3 years desensitize, and there are clinics for desensitization. Now, as I said, there is not every desensitization allergy conditions. They are selected ones where they have been able to do this. Not in every conditions that there is. So again, as I told you, this is an hyperreactivity. It involves the respiratory tract. It can be perfume, cold air, smoke, dust, any stimulus that can be adverse to our system. Here, if you look at the eczema in childhood, this is how it develops, and you have got to avoid, possibly maybe due to food or milk or whatever it is, and you need to treat this in early stage so that they don't go into food allergy, don't go into allergic rhinitis. So again, as I said, allergic conditions are not specific. They can be multifactorial, environmental, health, genetic, hereditary, family, and also what you do is that you have to take this history before you diagnose a patient that this is an allergic patient and go and treat it. So history is very important. If you look at this here, genetic constitutions contribute with other environmental factors, and basically what happens is it starts rising because it's genetic, and they are similar to those reactions which the families had or the mothers and the fathers had, and it goes to become a clinical symptom of a kind. So it slowly develops into a clinical manifestation or symptoms of its kind. Chromosome 11 contains genes for Fc receptors. Forget about this. I'm not going to ask you about this, but as I can say here that these are atopic allergy conditions. You just read it. I am not going to ask you as I have said it. All right. So again, you have symptoms. You have got inflammatory responses, eosinophil rise, leukotrienes. You go on highly allergic or resistance. Again, sensitization, allergic specific where you have done it. Exposure from childhood, genetic status is atopic conditions. So atopic conditions keep on till you go to the airway obstruction process. This is just to show you if nobody is actually has atopy or allergic rhinitis, it may be about 5 to 15%. If one of the siblings has it, the chances of other child having 5 to 35. If one parent has it, then it's 20 to 40%. If both parents have this, and again, if the parents had the same symptoms, then it's quite high in the family. So it's a genetic predisposition to allergic diseases. Okay? Now you don't have to remember these percentage. I'm just telling you. Again, there are a lot of pictures in here which you probably might not look. If you have an allergic reactions, it requires prior exposure to the allergen. That means a person has been exposed to any allergen. Don't go into interleukins 4. They all play a very important part, okay? Because that's how the cells are processed, and this is how the IgE is actually produced by the plasma cells. And again, you have mast cells both on the basophils and also on the mast cells, which are very potent things. This is a resting mast cells. This is all broken up, so the histamine has been released, vasoactin has been released, and that's where it attacks the other parts of the organs. Again, as you can see it, particles airborne can be, these are, you'll never believe it, these are dust mites which are in your home. If it's humid, air conditioned, carpeted, you will not see it with your naked eye, but it is there. So it's the best thing to always vacuum it and put some powder around to get rid of this, because some people never realize that because of these dust mites in the house, they are getting this allergic reaction. This is what a rat peritoneal mast cell is. This is degranulation of mast cell, release of histamine and vasoactive amines. Again, as I told you, I'm not going to go through this. IgE levels is very high, serum IgE levels. You can have levels with people with atopic eczema, very quite high, hay fever, which is your aeroallergens, perennial asthmatic conditions, atopic eczema. So again, what I'm trying to tell you is, in many of these conditions, the level of IgE antibodies will rise. You have got to arrest those rise. You have got to treat the patient at that particular time so that it does not lead to more complications into the allergic disorders. You look at this, anaphylaxis and urticaria, this is what happens. It starts swelling, okay? And this is what the rashes are on the body of a person who is allergic to. There are a lot of things, swelling of the conjunctiva, running nose, confusion, headache, swelling of the lips, many of these different things. Just read it for your sake. I'm not going to ask you all this, but this is for your knowledge, okay? What else I need? As I told you, there are histamines, toxic mediators, which are there, cytokines are there, which are also released, chemokines and mediators of leukotrienes, platelet, increase vascular permeability, cause a smooth muscle contraction. So all these can cause many of these symptoms or connective tissue problems which are there. So just read it. Again, as I said, I'm not going to go into details. It's for your knowledge. Again, read this. As I told you, systemic anaphylaxis, urticarial rashes, rhinitis, asthma, food allergy, all these are attributed, or these were the things which are very potent allergens in individuals that can happen. One thing is very important is the type of allergy that a person has encountered. In my childhood, I may not be that potent allergic carriers as such. So basically, it depends on the age. The earlier the age, the more potent allergic conditions will be there in the childhood than in the adult stage, because we have faced situations. We have been tolerant to many of these things. Okay, we have been exposed time and again, millions of times. All right. So again, I want to show you something which I'm talking to. I've talked to you about this. Immune response normally, downgrade, whatever you have to do, formation of IgE antibodies, treatment. So treatment is allergen avoidance, food, dust, pollen, pets, house dust, mites, whatever it is, drug therapy you have to give, and finally desensitization of individuals that you have to do, especially with allergic conditions. Now, these allergic rhinitis affects the upper respiratory, upper airways. I'm not going to go into this. Eczema, again, from the edema, skin, epidermis involved, okay, present in children under 5 years of age, urticarial rashes. We sometimes it's contact dermatitis. You touch a plant and you get urticarial rashes. That's not allergic, that's a contact dermatitis, okay, because they may be carrying something which may be not suitable to my skin. Or you wear certain clothes, and clothes may have been dyed or bleached or something like this. And so these are contact dermatitis. One can be have adverse reactions to any food. So I see they all have tummy, they're running to the loo, the toilet. You see here, you have a guy. This guy, you invite him to your home for food with his parents, right? You give the child nice food. I'm sorry, I'm allergic to it. Man, God's sake, you're not allergic to it. He says it to avoid those food. But if you give him hamburger and sausages, he will eat, and that's what he's doing. He's eating the ice cream here. So that is just a joke, but it does happen. When you go to somebody and you don't like the food, say, I'm sorry, I'm allergic to this food, or something like this, and you don't want to eat. So that's an avoidance. As you can see here, all the fish, the eggs, the chicken, they are allergic. Soya, milk, peanuts, many of these nuts are happening, they are allergic. What I want to show you here is a small thing which is for you. Now, if you go to the Chinese restaurant syndrome, you know what you are going to have because you have the PBL with you. Now, look at this one. Look at this one. If a person says, I was eating potatoes, or I was eating apple. And suddenly I had this allergic reaction. You know, my tongue got swollen, my lips got swollen. You see my hand, and you say, oh, you ate apple. Yes, so you may be allergic to apple. Stop eating it. But as you can see here, cross-reactive with potatoes, carrots, birch pollens. So this one food cross-reacts with many other food, such as carrots. So one has to be careful eating potatoes, one has to be careful with carrots. A girl came in one of the clinics in London, and she says, whenever I touch potatoes, I get my hands all blistered, everything is happening. Let alone eating the potatoes, only touching it. She had all these skin rashes, you know, swollen lips and this and that. She was very allergic to potatoes. So you never can predict in your patients who is allergic to what. It depends. When the allergic reaction comes, then you try to find it out and save the child or give preventive, drugs. If you look at carrots, if a person is allergic to carrots, should never eat carrots. But celery, apple, potatoes, rye, wheat, they can be cross-reacting with carrots. Similarly, what I'm trying to tell you is, if people are aware of these cross-reactivities which can happen with certain food, you have got to look at the chart. You won't remember everything. I don't remember everything. Look at the chart, and there is a chart available to see that if you are reactive to this, you should also avoid this. So this is a common sense which we have. Again, as I said it, we still don't know very much about clinical symptoms. We know now how to prevent it. We know how to treat it. But as I said it, asthmatic conditions are still there, and it cannot be treated other than it can be managed. That's what it is. I leave you with that. As I tell you, you have dust mites, you have other antigen present, allergen present particles, and basically what happens is the eventual is the mast cells. The IgE is released because of the cytokines processing of the antigen. Cytokines, then it involves the B cell, plasma cells, it becomes plasma cells, release IgE. IgE will degranulate the mast cells and eosinophils, basophils, and again you will have these mediators coming out. Okay? Now, just ask me now anything about it. Anything? Yeah?
Why we cannot give desensitization for asthmatic people?
Look, the question here, asthmatic is a condition. This condition has developed over years from allergic this thing. How are you going to treat the asthmatic conditions and desensitize for what? Do you know?
For dust.
No. For dust. How do you know for dust? Asthmatic condition because of the dust? Maybe food allergy, maybe aeroallergens, maybe eczema early. What I'm trying to do is, you don't treat a patient and leave him to develop into a terminal disease. You don't do that. You cut it off right there so that they don't develop all these implications, complications that can happen. That is a very late stage. You cannot do it because now they have a chronic infection. And you cannot cure those chronic infections which has been carrying on. You cannot, if it's a genetic factor involved, you cannot reverse it unless the child is in the womb and you go there and correct the situations. So you only do it as it comes. Don't go to the last stage of cancer and say, look, why didn't I do this when I want to do this? No, no, no. Okay, now it is the full system is involved in that. Any more question? Ask me.
Thank you, Dr.